Due to the pressure of the Omicron variant, increasing numbers of hospital staff are either taking sick leave or leaving the medical field in general due to fatigue. In many places, the pay at Walmart is now better than a hospital. As the COVID epidemic continues to sweep across the U.S. unabated, the ability to find qualified hospital staff has reached a disturbing low, largely due to burnout of staff. This lack of manpower is worse than many experts have experienced. Sally Zuhl, Vice President of Human Resources at Union Health in Terre Haute, Indiana, said, "This is the most significant labor shortage that we have ever seen." This lack of labor power has been a terrible bane for hospitals and patients. As people are quitting these jobs due to fatigue or sickness, the number of new personnel required on top of those that have left is increasing. As with any market mechanism, low supply, high demand increases price. According to data from consulting from Kaufman Hall, labor expense per patient was 26% above the pre-COVID level 2 years earlier. This is particularly troublesome because there was already an ongoing shortage of doctors and nurses before the COVID pandemic even began. Terre Haute, Indiana is an example of just such a shortage. In order to keep all of the 12-hour shifts filled constantly, they are having to take support staff and moving them into direct patient care. Radiology, lab technicians, phlebotomists, and respiratory therapists are all hard to find. According to Bloomberg, in November, as COVID spread throughout the state, Indiana's unemployment rate was 3%, or 1.2% points lower than the national level. The tight labor market has had ripple effects. Sometimes short-staffed pharmacies close without notice, so patients can't pick up their prescriptions after their discharge, hospital officials said. In Nebraska, where the unemployment rate is only 1.8%, low-level positions are now having to compete with the local Walmart in terms of wages. Tony Bruntz runs Community Hospital, says what used to be an $8 job is now $15. That's the only way we get people to come to work. This is particularly disturbing because hospital staff are needed much more than retail staff. A society that places more value on moving commodities than the health of its people is a questionable society indeed. Reporting from Niagara Falls, Jason Unruhe, MRN.
Thank you for watching. If you like this program, then please head over to my Patreon page and set up a monthly donation. It's your donations that keep this program running. Also, if you would like, please rate, comment, subscribe, and share in various social media.